My name's Peter Wood. I'm an obstetrician at the Sydney Adventist Hospital, and here we are in the special care nursery and I've been working here since 2009. Pregnancy as a whole is a normal experience for women. It's not really to be considered an illness or a disease, and if you just have that general premise, then that's the way you should approach pregnancy. It's a healthy, normal experience for women. There are occasions, however, when things stray from normality, and that's why we have an antenatal program in Australia here, and which we adopt here at the SAN, to reduce the risk of complications. But just going on that healthy theme, it's a healthy experience, so this is the sort of healthy things you should do during your pregnancy. Having a healthy, balanced diet. The only thing that you need to really consider is some dietary supplements, such as folic acid in the first 12 to 13 weeks, and maybe some iodine during the rest of the pregnancy. A healthy diet should involve fresh vegetables and fruit, lots of water, and things to avoid are the high GI food groups, such as soft drinks, fruit juice, white bread, unfortunately chocolate, although dark chocolate is probably better if you have to have chocolate, but more importantly, it's about a balance and a variety. There are a couple of things you should avoid when you're pregnant, and that is to avoid a condition called listeriosis. Listeriosis is a bacteria that is unusual compared to other bacteria, and it grows in a cold environment. So for some reason, refrigeration doesn't prevent listeriosis, which is why it's unique. And the sort of foods that can be prone to listeria is unpasteurized milk and raw or smoked meat or seafood. So it's not good for anybody, whether they're pregnant or not, to get listeria. But if you're pregnant, not only can it make you sick, but it can unfortunately induce a miscarriage or cause significant fetal problems. None of us want that, so we recommend that you avoid unpasteurized milk, which would include some weird cheeses like blue cheeses or those soft cheeses. But on the packet, it will say if it's made from pasteurized or unpasteurized cheese. But all the normal cheeses like cheddar, mozzarella, parmesan, they're all fine to take, so it doesn't mean you have to go on a complete cheese-free diet if you're a cheese freak like me. The smoked or raw meat or seafood includes things like smoked salmon, smoked oysters, salami, sandwich ham, those sort of things, which you shouldn't have cold. It is okay to have them on a pizza or something cooked, but just not cold, because they also may contain listeria, and again, it'd be bad for anyone to get it, but particularly in pregnancy, it's bad. And Australian health standards, all the food manufacturers are doing all their best to try and avoid listeria, and if listeria is found in food, it's a national health crisis, so it really is an important condition to avoid.